The body has a very limited way of dealing with foreign objects. When you put a foreign object in the body, one of three things is going to happen. Either the body will destroy it. If it can't destroy it, it will try and excrete it. And if it can't excrete it, it will try and isolate it. And that's where the problem comes in.
We all in medicine know it's important to be aware of the potential dangers and risks associated with silicone implants.
A large number of women were coming forth with complaints. Fatigue would be a natural thing for women who are getting sick from breast implant toxicity to develop. When in fact, the breast implant illness is probably best defined as a biochemical disruption. When some of the degradation molecules of silicone gel also biointegrate into these molecules that are holding these preformed mediators of inflammation, the mast cell may release their contents without provocation, and hence you get urticaria and hives, skin rashes, and itching. Three things that a prospective recipient would want to know before they put these devices in the body. The first thing they need to know is that...
Welcome to another episode of Health Frontiers with Dr. Bob. Today, we're honored to have with us an expert on a topic that most of you are familiar with, but not in detail. But those of you who are more interested in becoming familiar with the whole science of implants. And Dr. Arthur Brawer is our guest today, a board-certified rheumatologist whose educational career was developed at Brandeis University and the Boston University School of Medicine and Boston University Medical Center. For 48 years, he has maintained a private practice in Long Branch, New Jersey, and has agreed to come up from the Jersey Shore to meet with us and talk about this very interesting topic. He's Associate Professor of Clinical Medicine at Drexel University School of Medicine in Philadelphia and Assistant Clinical Professor of Medicine at the Robert Wood Johnson School of Medicine in New Brunswick. His research interests are vast, and he has publications which encompass new arthritis conditions, new arthritis treatments, physical trauma and arthritis, vaccine-induced toxicity, which he is an expert in, rheumatoid arthritis, systemic lupus, polymyalgia, and the list goes on and on. But what we've got him here for today is to talk about implants. And I know all of you out there have a relative, perhaps a loved one, with an implant in some part of his or her body. And so Dr. Brawer is an expert and is often invited to give testimony before the U.S. Congress, the Health and Human Services, Food and Drug Administration, and he's been aides to the President's Chief Healthcare Advisors and the Director of the Office of Women's Health at the White House. So welcome, Dr. Brawer. It's
Thank
good
you,
to have
Dr.
you
Bob.
here.
It's good to be here.
It's a great pleasure to have you. So I'm going to start off, and I know our audience is very, very interested in this topic. The first thing is that these silicone implants, as that's what we call them, were commonly used in cosmetic and reconstructive surgery, particularly for breast augmentation. And I know many of you ladies have breast augmentation and reconstruction with these implants. While many individuals experience positive outcomes, we all in medicine know it's important to be aware of the potential dangers and risks associated with silicone implants. So would you tell us the difference between, first of all, silicone implants and saline-filled implants?
Yes, of course. So silicone implants essentially involve a chemistry that created artificial silicon carbon bonds. As you probably know, there are no living organisms on land, in the ocean, or in the air that are capable of making compounds that contain artificial silicon carbon bonds. Now, so silicone ends with an E, but the silicon, which is an element on the table of all elements, including carbon and oxygen and sodium.
The periodic table.
The periodic table, right?
Yes.
And of course, chloride and magnesium and even gold and silver. Silicon is an essential ingredient in terms of growth and development, and the molecules that are the glue in the body that keep things together, such as ligaments and tendons, and they keep your skin cells from flying off into outer space.
Oh, fascinating.
So the silicon itself is an essential ingredient in the human body, but not silicone. No living organisms, not humans either, have the capacity to make a silicone molecule. This was the invention of chemists 100 years ago when they created the field of organosilicon chemistry.
Very fascinating. So then we can expect that placement of silicone or silica in the body will create a problem.
Yes, and the body has a very limited way of dealing with foreign objects. As you probably are aware, when you put a foreign object in the body, one of three things is going to happen. Either the body will destroy it. If it can't destroy it, it will try and excrete it. And if it can't excrete it, it will try and isolate it. And that's where the problem comes in.
Now, many of my patients over the last 40 years, and I think this goes back to probably the 1960s when there was a big hubbub about women in particular who had silicone breast implants and developed disease as a result of that. That is clearly different, is it not, from the silicone or the gel saline implants?
Oh, yes, completely different.
Okay.
The saline implants have basically silicone molecules that were then blended together to make an envelope or shell, a solid. What's inside the silicone gel-filled breast implants is, of course, a gel, a viscous compound.
Right. Okay, that's very interesting. Do they break?
The body, when it tries to isolate them,
Yes.
With a variety of what we call immunocompetent and inflammatory cells, can secrete certain enzymes that will break the bonds and release silica, coal miner's dust,
Yes.
which is what's necessary to go from silicone, a viscous gel, into a solid elastomer that surrounds the implant.
Well, that's very interesting. Okay, so we're talking about a foreign object such as a silicone gel-filled breast implant. Are they inserted into the body at this time? And when they were, and I remember the dermatologists in New York City and other so-called experts who were putting these implants in people, what were the things that happened? You outlined three possibilities here.
Well, I think in the late 1980s, you could probably sum up the world literature in one sentence at that time, and that is that silicone gel-filled breast implants, when inserted into a live human being, had the capacity to make the recipient ill. The literature did not specify that there was indeed such an illness, nor did it specify that what the illness was. And then, of course, a few years later, in 1990, as you're probably aware, journalist and newscaster Connie Chung put a broadcast on and basically reported that a large number of women were coming forth with complaints about their gel-filled devices.
How many women did she look at?
After her broadcast, 400,000 women across the country showed up at the front doorstep of their attorney's office because they wanted to participate in the new class action suit against the four major manufacturers of breast implants at the time. And they were, of course, Dow Corning, 3M, Baxter Healthcare, and Bristol Myers Squibb.
Aha. And did they win this lawsuit?
Well, the lawyers created a class action suit, but along the way, when they did that in the early 1990s, they defined silicone gel-filled breast implant toxicity, which I will use synonymously with breast implant illness. They defined the disorder in the courtroom before it was actually studied properly in the exam room. And what they did is they went to the rheumatology textbook and they listed all the diseases that you and I commonly deal with: rheumatoid arthritis, systemic lupus erythematosus, Sjogren's syndrome, scleroderma, myositis, and the like. And they basically incorporated into the class action suit criteria such that if the women developed one of these disorders from her gel-filled device, she would be compensated. So to reiterate, again, the disorder was defined in the courtroom before it was properly studied in the exam room.
Oh, boy. And was it a vast sum of money that was distributed at that time?
Yes, around $4.5 to $5 billion, I believe, at that time.
At that time.
That was over 3 decades ago.
Wow, that's amazing. Well, we all are aware of the silicone issue and controversy. At least we in medicine are all aware of that. But the public, I don't think, has a full mindset about it. And by the way, I've had patients with implants in their jaws, in their lips, and we've even had males with implants. And those implants are in their sexual organs or other things which did involve silicone, and I presume now does not.
The implants today are still solid silicone. The facial implants,
Right.
the knuckle implants, and things like that. They have been shown to undergo what we call spallation or fragmentation. And when they do that, the pieces of the solid implants will migrate into the lymph nodes and cause some problems.
And they circulate in the blood, these, because we're hearing, and everybody in the audience knows, we talked a few episodes back about plastics in our brains and plastics in our body. But now you're telling us about something which is technically an inert object, such as plastics, I guess, and that is fluidly present in all of us that have implants.
For decades, the chemists advised the general public and physicians that silicone, either gel or solid, was chemically and biologically inert. And of course, nothing can be further from the truth. The body has the ability to degrade these molecules into smaller subunits. Some of the smaller subunits can cross the blood-brain barrier and chelate neurotransmitters such as dopamine. Hence, you're not necessarily dealing with an itis or an inflammation that causes the brain fog and problems with memory. Some of these subunits have the ability to incorporate themselves into the matrix macromolecules, which I described as the glue in the body, the place where silicon, the element silicon, normally is utilized to provide strength and tensile strength. And when that happens, wherever these matrix macromolecules may be, they can malfunction. So, as an example, in the nervous system, the sensory nervous system, the receptors for pain and light touch and temperature and things, they have very complex receptors. But part of those receptors are these matrix macromolecules. So when the silicone degradation molecules biointegrate into these molecules, hence the nervous system, the sensory nervous system, may send impulses to the brain that something's happening when indeed there are no stimuli that are present. So that's part of the reason why the women with breast implant illness develop paresthesias or numbness and tingling. Now, in mast cells, which are cells that line blood vessels and have preformed mediators of inflammation that, when they're released, cause urticaria and hives and itching, matrix macromolecules bind these preformed mediators of inflammation so that the mast cell doesn't degranulate and release them without provocation. But when some of the degradation molecules of silicone gel also biointegrate into these molecules that are holding these preformed mediators of inflammation, the mast cell may release their contents without provocation, and hence you get urticaria and hives, skin rashes, and itching. But there's one more facet to that, because once these mediators of inflammation are released from the mast cells, they are capable also of crossing the blood-brain barrier, and they will activate fixed white cells in the brain called microglia, which don't circulate, they just stay there. And they have their own mediators of inflammation that they can then release. And hence, you're starting to get the picture that there are cyclical reinforcing mechanisms here going on in terms of the phenomena that breast implants may exhibit when they start to become ill.
Well, you really described two different systems, which are quite interesting: the peripheral body and its nervous system, and the brain. And by the way, for those of you who don't know what the blood-brain barrier is, it's a membrane that prevents anything but spinal fluid and plasma from exchanging both parts of the body, the cavity where the brain lies and the rest of the circulation. So you're saying that these molecules pass the blood-brain barrier, get into the brain and affect the microglia, which is, by the way, an immunologically designated cell, which is very important to the brain and its immune system. And by the way, the immune system has, you might call them, properties in the brain as well as in the regular body, which are the lymph nodes and things of that sort. So you're saying that besides plastic, which we have milligram quantities according to some in our bodies and in our brain in particular, we probably have a lot of silicone if you're a woman with implants that get removed and re-edited and removed. And some of these ladies that I've seen in my office have had several iterations of implants.
I think the confusion early on in the early 1990s with the idea that the lawyers propagated that silicone breast implant illness is an autoimmune phenomenon came about because there was a knee-jerk response to some of the complaints that the women were manifesting. So they had joint pain and swelling or arthritis. They had chest pain. They had skin rashes. They had fatigue. They had brain fog and problems with memory lapses.
And all of that, if I may interrupt you, is a result of immune stimulation of the mast cells.
Well, I think there's a lot more to the toxicity than the mechanisms I just described. We've actually only touched on the number of mechanisms. There are probably at least 24 mechanisms whereby breast implant silicone gel molecules, once they break down in the body, are capable of causing illness. So, for instance, the receptors in your muscle for a neurotransmitter called acetylcholine, which will attach to its receptor and make your muscle work. It'll make your muscle contract.
The cause of twitching and the cause of muscle movement.
Exactly. So when these molecules, these degradation molecules of the silicone gel, which are constantly bleeding through an intact envelope or shell from the breast implant, when they biointegrate into those molecules, what do you think the result is going to be? It can be weakness, it can be muscle twitching, it can be myalgias or muscle pain. So here you have a whole constellation of symptoms and signs that are similar to what rheumatologists often deal with every day, except the disorder is not one of autoimmunity. The disorder involves at least a couple of dozen biochemical disruptions in the body that can produce the illness.
It's a toxicity, really. It is not an immune-based, at least not a directly immune-based illness.
Exactly. And I think the most important aspect I can relate to you from my research on that is that when you look at the development of breast implant illness over time, in other words, you insert the implants and then you take a time period when the first symptom or sign develops, and then you follow all the rest of them as they develop over time, the curve, the disease development curve, is a dose-response curve. Now, dose-response curves are at the heart of toxicology. That is toxicology.
Right. And toxicology, by the way, is a specialty that looks at poisons and illegitimate chemicals within the body. Go ahead.
So none of the diseases that you and I deal with on a routine basis, which I mentioned before, rheumatoid arthritis and things like that, or systemic lupus.
Scleroderma, for example. I mean, everybody's been talking about scleroderma from silicone implants.
Right. So they don't develop chronologically like a dose-response curve.
Right.
And this has been known for decades. I think what was very interesting in the 1990s when the lawyers defined the illness as being textbook conditions that you and I deal with and autoimmune problems, it was an easy project for implant manufacturers to follow with studies that showed there was no higher incidence of these textbook disorders in breast implant recipients compared to the general population. And so once you got rid of the fictitious illness, that made short shrift of the legitimate illness. And that's why breast implant illness was destined to repeat itself.
Now, you just brought up a very interesting topic, and that's legitimate versus fictitious. And a lot of doctors and a lot of people out there think that if you can't measure something in the test tube, in the laboratory, if you can't send a test out and find an abnormality, the patient's got to be nuts. And I just want to say regarding chronic fatigue syndrome and fibromyalgia, those conditions where there are no blood tests and yet the patients feel horrible and they are weakened and can't get out of bed, that is the kind of stuff we're talking about here, where this is a biological response to a toxin. Am I right?
Exactly. And it took, as you know, 50 years before chronic fatigue syndrome, also known as myalgic encephalomyelitis, before that was recognized as a legitimate entity.
Yes.
Now, we're roughly 30 to 35 years into the breast implant situation, and we still don't have a rheumatology standard textbook that will list for you the criteria of breast implant illness and verify its existence.
Right. Very fascinating. So we're dealing with a conundrum of sorts. Science has not caught up to measuring the toxins that can certainly, as an environmental influence, and I go back to one of my favorite topics, epigenetics, which is alteration of gene expression from the environment. And would you say that silicone toxicity and other toxicities like PFAS and plastics and all that are environmental influences on the human physiology adversely?
Sure. And part of the reason that living organisms cannot make silicon carbon bonds and create these molecules that the chemists did artificially in the laboratory is because although silicon forms 4 bonds like carbon, it behaves like a metal at times. And I'm going to disencumber this phrase in 1 minute, but first I will just state that phosphorus is metal ion bound in energy systems. So you can't put silicon molecules next to phosphorus molecules in mitochondria and elsewhere and expect energy production and energy utilization to proceed normally.
Okay. Mitochondria are these little organelles in every one of our trillion cells that are the real factories of the cell and which allow your muscles to work, your eyes to see, your brain to function. When Dr. Brawer refers to mitochondria, that's probably the most important organelle in the body, which is, by the way, inherited from mom. Go ahead.
So mitochondria have a process called quantum tunneling, or an electron transfer process, whereby oxygen is the final recipient of these electrons in order to make what we call ATP, adenosine triphosphate, which drives the energy and all the body biochemical processes.
It's the most important molecule in the body,
Of course.
Agree.
This is life itself.
Yes.
Well, these enzymes in the electron transport process contain copper and iron. So when you put silicon molecules next to copper and iron, you make this process dysfunctional.
Yeah.
The net result of that is that you produce what's called oxygen-derived free radicals, and they are capable of altering gene expression. So more simply, you may take a gene that's beneficial and turn it off, and you may take a gene that is harmful and turn it on.
Wow. That is very important information. That information, because we're understanding more and more about how the environment affects our behavior, as well as our gene expression, and most importantly, the diseases that we get.
So we've been talking about a number of the symptoms and signs that encompass breast implant illness. And therefore, if you think about this, fatigue would be a natural thing for women who are getting sick from breast implant toxicity to develop. Now, that's not an itis or an inflammation or an immune dysfunction. That's another biochemical disruption. So now we've moved from the matrix macromolecules, the glue, into the mitochondria. And there are a number of other factors as well that produce other biochemical distortions in the body. And so I think it's unfortunate that after 3.5 decades of research in this area, researchers are still focusing on trying to find the autoimmune and inflammatory connection, when in fact the breast implant illness is probably best defined as a biochemical disruption.
And it's like many other things which we have yet to define that cause biochemical disruption within the body.
Precisely.
Toxins like
Precisely.
dietary influences, environmental influences, temperature changes, stress. All of these things produce disease or dis-ease. All of these produce disease, which we really can't put our fingers on, but yet patients come and say, I'm so sick and I don't know why. And every doctor tells me there's nothing wrong with me. That's it.
When you start with the laboratory first and you try and force fit the patient into the laboratory, you're going to run into trouble. You've got to start with the patient first. I think my research really came about in terms of methodology from Steer and Malatesta, who 50 years ago, in 1975, described Lyme disease.
Yes.
Their methodology was extraordinarily sound. Now, remember, there were four main aspects to Lyme disease. There was the prodrome with the skin rash and some constitutional symptoms. Then there was the cyclical arthritis, which could come and go.
Yep.
Then there were the neurological phenomena, such as a foot drop. And then you had the cardiac phenomena, which was the heart block. And these things obviously are not necessarily specific for anything by themselves. But what Steer and Malatesta did is they looked at the chronological evolution of these four items. What came first, what came second, what came third, and how long did it all last? And once they did that, once they applied the chronological evolution to it, which is academic torture, as you probably know, because it could take 3 or 4 hours just to examine one patient.
Yes.
Okay, then they knew they had a new illness. Nobody did that with the silicone breast implant patients who are complaining of a whole host of signs and symptoms.
Yes.
Because that takes 3, 4, 5 hours to see one patient, especially if they're manifesting cognitive dysfunction. How do you possibly place all of these items that they're complaining about into a logical time sequence if they can't remember things?
Right. Very, very interesting. And we rely on the patient history. When you go to see your doctor, for those of you who are watching us and thinking and putting yourself in this situation, when you see your doctor, that's why it's so important to sequentially get your symptoms correct and what you feel. And the doctor, he or she will have to sort this out to come to a diagnosis in a very cogent way. You would agree?
I would definitely agree. I think it's easier sometimes when you begin with things that the patient can remember.
Yes.
Such that a wedding or the birth of a grandchild or a vacation in Hawaii or when they got a new car or when they got a new job. Okay, and once you fix those types of things in time and place, then you can start bouncing all their symptoms off each other and off those fixed items. And that's exactly how you develop a chronological evolution of their disorder.
Wow, fascinating information. Now, let me ask you something. I know there are a lot of viewers out there who are sitting here saying, give me some advice. I need breast augmentation. And God knows I have countless numbers of these patients. And they are going to Latin America, Mexico, Ecuador, Peru, to get implants done cheaply. Is there a danger of these women and men probably going with augmentation of the buttocks, for example, which is a big fad today? Is there a danger from them leaving the confines of the United States of America?
There's a danger no matter where you go. And there are basically 3 things that a prospective recipient would want to know, 3 or 4 things actually, before they put these devices in the body. The first thing they need to know is that once these gel-filled devices are inserted in the body, bacteria will colonize the inside and the outside of the device. Mm-hmm. When they do that, and by the way, Dow Corning themselves, one of the recipients of the class action lawsuit, showed as early as 1999, I should say, or the year 2000, they showed that bacteria have the capacity to break down these molecules into smaller subunits that will then bleed through the envelope or shell because they become smaller than the pore size or envelope of the shell. So they need to know that. Number two, they need to know that once they do that, they can also go through a fibrous capsule that encompasses and encircles the device, the implant device, and it's been shown that they will disseminate and distribute to very distal parts of the body. And we've already talked about what some of those can do in terms of crossing the blood-brain barrier and things like that.
Yes.
And they also need to know that nothing lasts forever. So the rupture rate of the implants by the year 2000, which is 25 years ago, was already shown to be 5% per year. And that hasn't changed. That's exactly the same.
Interesting.
So that all that incorporates itself into what we call informed consent.
Yes.
Something solely lacking to the average person who's thinking about putting these devices in their body.
So you're advising women who are going to get augmented breasts and buttocks to go through informed consent. I dare say that probably in Latin America or in Central America, informed consent doesn't exist. I don't know. And I apologize to all of our Latino colleagues in South America and Central America who probably do, some of you do use informed consent. But by and large, it's unlikely.
It's highly unlikely, and it's actually pretty infrequent that it occurs. Yeah. There's actually a fourth component that they need to know as well. There are roughly 35 other chemicals besides the organosiloxanes, besides the silicones, that are incorporated into the breast implants in order to manufacture them. And a great number of these chemicals are not exactly the kinds of things that you would want in your drinking water.
Wow. Well, that's fascinating. That's a statement and a half right there. I'm sure that these are newsworthy comments that can be picked up by the national media. So what you're saying then, if I am a young lady who wants breast implants, I need to sign an informed consent and be aware of the downside of these implants, which is not for everybody, and saline-filled implants at this time. But they still have, according to your notes, they still have the possibility of bacteria being present, especially if the implants are poorly implanted, that is non-sterilely necessarily, and we can get into that in a second, because I've seen some horrible stuff, and I'm sure you have too, that bacteria can cause a real problem.
Definitely. It's never been my crusade to prevent women from getting silicone gel-filled breast implants.
Yes.
It's only been my research whereby the women need to be informed of the potential complications. It's like anything else. It's like you're undergoing gallbladder surgery.
Yes.
So what are the benefits and what are the side effects and what are the complications? So if, as a matter of fact, it's now exactly 4 years since October of 2021 that the FDA finally mandated a black box warning on the breast implant devices and the items that surgeons in the United States must tell women before they agree to undergo the procedure.
And what might those things, in a summary?
The summary is just the 4 items I just mentioned.
Yes.
1, nothing lasts forever, so the rupture rate is 5% per year.
Wow.
2, the bacteria that colonize them have the capacity to break these molecules down into smaller units, and when those smaller units have the capacity to traverse and bleed through an intact envelope or shell, and also right through the capsule that forms around the implants, and then they disperse to distant parts of the body. We talked about the additional chemicals that are in there. So all the things we talked about in terms of the things that women would want to know, I think that's what the black box warning is all about.
That's fascinating. And I'm being educated right now, as I'm sure all of you are, that this is really formidable information that a woman must consider and must think about prior to getting all of these augmented organs or rather augmented breasts and buttocks and every other part of
Now,
her
you
body.
neglected to ask me one key question.
Go ahead, Arthur. Which one did I
What's the percentage of women who will, after putting breast implants, gel-filled breast implants in their body, get sick?
What is the percentage?
Well, we don't exactly have that figure, but I can tell you this. I've seen a number of women who have breast implants in for 18 or 20 years that are ruptured, and even under the white-hot lights of my scrutiny, they're not ill. They're perfectly normal. They don't have any things they want to complain about, and the physical exam is entirely normal.
Right.
I don't know the exact percentage. I just know that 400,000 women showed up at the front door in the early 1990s.
Yep.
And by roughly 2018 or 2019, when the FDA held its last public hearings on breast implant toxicity, there were 350,000 women who had already notified the FDA of grievous systemic ailments that they attributed to these devices.
Wow.
So the number is up there.
Wow, that's extraordinary.
I think your constitutional makeup determines how you react to toxicity.
Yeah.
So I could send 100 people into a candle store, but after a half an hour, only 20 of them might be getting a little nauseous or dizzy or a headache from the vapors and the aromas. And to drive home the biochemical aspect.
Very interesting analogy.
Yeah, right. And to drive home the biochemical aspect of this, what do you think blood tests would show? And the answer is nothing. And what do you think the doctor would find when they examined them? Nothing, okay? I think that probably should prompt your question about what I did at the bedside to further distance myself from the autoimmune proponents.
Yes.
Okay. Well, we start with the basics. So if you have a kidney problem or a bladder problem, the doctor's going to look at your urine. So if you have an arthritis problem, what are you going to do? You're going to look at the joint fluid. And if you have a large accessible joint like a knee, taking the fluid off can sometimes help you understand what's driving the patient's complaints.
Yes.
So in my skepticism to the autoimmune theories in the early 1990s, I did just that and many things more. So when I took fluid off women's knees who were complaining of ailments they thought was related to their breast implants, the fluid was totally non-inflammatory. There was no inflammation like you would see with rheumatoid disease or scleroderma or lupus or myositis or any of the other disorders that we deal with. So then we took the women with muscle complaints. They had either muscle weakness and fatigue, and we did biopsies of the women's muscles. And guess what? It was, again, like the old Wendy's commercial. Where's the beef?
Yeah.
Because the muscle biopsies were completely normal, all right? And lastly, 75% of the women that were complaining of multiple ailments included also dry eyes and dry mouth. So I had my ear, nose, and throat colleagues start to biopsy the lacrimal and salivary glands in these women, looking for the patterns of inflammation that rheumatologists normally see in that condition, something we call Sjogren's syndrome.
Yes.
The biopsies were entirely normal, yet the women were dry as a bone. So 75% of them, you put a piece of filter paper in their eye, and they made no tears. That brings us back to the matrix macromolecules, because the receptor for acetylcholine...
That's that famous chemical that causes muscles to react and twitch and move. Yeah.
Same molecules are stimulated by acetylcholine to produce normal tear formation. And when you block those molecules with the silicone degradation molecules that are disseminating throughout the body, you're going to have normal biopsies, but the women are still dry as a bone.
Amazing.
Now, nobody paid much attention to that with all that work that I did, and they're still pursuing autoimmune theories.
Yes.
May go on for another 10 or 15 years before somebody gets a bright idea that this is a biochemical disorder and a toxicology problem.
Right. Well, that's an interesting point that you bring up, because toxicology is something that we have virtually no training in as doctors, much like nutrition, I might add. And this is an area that may be up and coming, and you may be one of the pioneers of this particular area. Which is
we'll see.
Yes, we will see. On that point, I want to mention Dr. Brawer's book. Would you talk about your book, which is now, you said, out of print?
Yes.
It came out in the 80s?
It came out in, I believe, 1999.
Okay.
So that's 36 years ago.
And what was the title?
The book was called Holistic Harmony.
Holistic Harmony.
And in part, I wrote it, not just because people wanted to pursue alternative and complementary medication. Not everybody wants to take pills, for their ailments, all right? Yes. But in addition, I wrote it as not as a how-to book. In other words, how to get better. I wrote it in terms of the credentials that a practitioner should have if you want to pursue any of the 36 alternative medicine disciplines. So as an example, if you wanted to pursue herbal medicine, what should the training and qualifications and certification be of the physician who's going to prescribe herbs for you? All right. So I did that with 36 disciplines and outlined the criteria so that you, for these practitioners, so that you would know that you were being in competent hands.
I see. Wow. There may be an additional life for this book, which you said is sort of out of print now, because have you been asked to revise it at all by the publisher?
No, I have not.
It would be something that would probably be very appropriate now, considering.
Well, that brings us to the treatment of breast implant illness.
Yes, go ahead.
Because
Tell us about it.
anti-inflammatory medication for a biochemical disorder
Doesn't work.
Isn't right. It's a mismatch. Okay,
Yeah.
Which is why the drugs we commonly use, like Plaquenil or hydroxychloroquine, or any of the other medications, or even corticosteroids like prednisone, which is why they don't help breast implant patients and make their ailments better, because you're not dealing with an inflammatory problem.
Right.
So it's a complete mismatch. So either I leave them to their inexorable downhill fate, or I try and guide them with some alternative medicine disciplines and modalities that might make you better.
Right.
I think energy production is a big one. And so any of the energy disciplines, such as Qigong or acupuncture, things like that, Reiki therapy and things like that, often can be of significant help to these patients.
Well, that's very interesting that you say that, because I know so many women who are getting energy kinds of therapy like acupuncture and Reiki, and there are a couple of others. My wife is an expert in that area, but it is extraordinary that you're saying that. So you really believe that these kinds of procedures really help.
Yes, it's interesting. Take Reiki therapy as an example. There are a number of hospitals now that have credentialed Reiki therapists to help with patients in chronic pain, even patients with metastatic cancer who are in chronic pain. The Reiki therapist can help alleviate their pain. Mm-hmm. So I think there's a lot that we don't know about what some of these alternative medicine disciplines and modalities can do. But it's like I said, without being redundant, either I leave the patients to flounder or we try and do something for them. Now, getting them better, however, is an exercise in futility if you leave the implants in. In other words, if you're sick and you definitely have breast implant illness, okay, the severity of the illness increases the longer you leave them in. But it's a double-edged sword, so that the longer you leave them in, the less chance you have of getting better when you take them out. So the illness is a double-edged sword. Now that brings us to probably the most recent publication that verifies the illness. And this was done just in the past few years in Europe, where the researchers took two identical groups of women who had a variety of complaints that satisfied a breast implant illness label. One of the groups of women decided to leave their implants in, and the other group decided to take their implants out. And then they followed them for a number of years. And there was a statistically distinct difference, because the ones who took them out got better and the ones who left them in did not. So this is an adjunct to my own explantation research and publications, whereby we now know that this is a legitimate illness. So hopefully in the not too distant future, it may actually start showing up in rheumatology textbooks.
Yes, very important, very important. Well, we have a few minutes left here, and I want to talk about some of the things that happen. We talked about infection. And by the way, I just want to mention one thing, and that is I have a number of patients we've seen in the emergency room, some of them tragic, where they have gone to airport, and this is in the U.S., hotels, to have practitioners, actually charlatans, inject them with substances, not necessarily saline-filled implants, but actually more like silly putty or putty in general, and they get terrible necrosis and sometimes sepsis and die. These are criminal things, and I assure you that if it is cheap and it is readily available and you don't know the credentials of the person doing the injections, be very wary and do not let anybody inject stuff into your body that you don't know, A, what it is, and B, what the person's credentials are that's doing the injecting. So that being said, are there changes, are there breast pains and changes in sensation after implants locally?
Yes. The large percentage of the women are complaining of chest pain. They go through exhaustive cardiopulmonary workups, which are, of course, negative because they don't have a heart problem or a lung problem unless the silicone gel has migrated into the lung. Most of the pain comes from two areas. It comes from infiltration of the silicone gel into the nerves that run underneath each rib. And it comes from the pleura, the lining around the lung, which also gets infiltrated by the silicone gel degradation molecules. And that inflammation is an extension of the inflammation that occurs around the implant itself. Now, again, we're talking about local inflammation. We're not talking about systemic inflammation.
Right.
We're talking about the kinds of things where I said if the body can't destroy something or excrete it, it's going to try and isolate it. But that doesn't account. That's where the rheumatologists went awry because they thought that the silicone gel degradation molecules migrating to distant parts of the body would set up a similar type of inflammation that was seen around the devices themselves.
Yes.
And nothing can be further from the truth. All these different discrete organs that where silicone gel degradation molecules have migrated to, they've been examined now and they don't have any inflammation whatsoever.
Wow, that's amazing. So what about displacement of the actual implant itself? And the second question is, and I've heard this from radiologists, what happens when you're doing mammograms and you have saline-filled implants?
Okay. So there are two different topics. Let's talk about displacement and malposition first.
Yes.
It's actually, that is the forerunner of rupture. So that occurs roughly between, let's say, 5 years and 6 years or so, where after you've been implanted. And what happens is that there is a failure of the capsule. We're not just talking about the bacteria and the cells, the inflammatory cells that surround the implant. We're talking about the fine capsule, the thickness of a piece of paper or a little bit thicker that forms around the breast implant, okay?
Right.
The capsule starts to fail, and actually by the 10 years, you don't have just one layer of capsule formation. You actually have 8 or 10 layers of inflammation. And in between those capsular layers, there's no lymph flow, there's no blood vessels, there's no oxygen. And so that also can account not only for some of the pain, but some of the local breast phenomena. Right. The failure of the capsule in my research is one of the local breast phenomena that is the precursor of rupture. So that if you've developed that and you have malposition of the implant, sooner or later you're going to get a rupture. Yeah. And then the other part to that was what was the other part to that you mentioned?
The other part was the interference with mammography.
Oh, yes. So mammograms will only detect a rupture 55% of the time. So it's almost a 50-50 proposition. And MRI scans are a little bit better, 75 to 80% of the time, but they're not foolproof. If you get a rupture, this is almost what the surgeons like to call abscess breakdown. And so let's say you have a ruptured appendicitis, and you form a capsule around it, okay? Sooner or later, it's going to break down. You'll form another capsule and so forth and so on, but you don't have to necessarily operate on it. So the same thing is happening with the breast implant device. The capsule will fail. Another piece of collagen and connective tissue will form around it to try and patch it up. Right. And sooner or later, the whole thing is destined to fail.
Right. Will it interfere? The question is here, someone wrote in that interference with mammography can delay the diagnosis of a breast cancer diagnosis.
Okay, so now, of course, you're into the topic of anaplastic large cell lymphoma.
Right.
That particular type of cancer has clearly been shown to have an increase in breast implant recipients compared to the general population at large. I think it's very clear that just exactly what you said, you can interfere with the mammography, but the diagnosis of that is a high index of suspicion. And it requires proper pathologic examination of the capsular tissues once you take the implants out.
Mm-hmm. Unbelievable. The last point I want to make, because in the few moments that we have left, is the psychological impact of having augmentation of any part of your body. And these are women oftentimes who can least afford these implants, and that's why they go overseas to get them. But there's dissatisfaction in a lot of women with this cosmetic results, and then they're going to hear about the health implications of what the implant means. Would you have anything to describe or suggest with regard to a young lady? And I'm talking about late teens, early 20s, beautiful young women who have a distorted self-image, and really their emotional well-being is very, very suspect. What kind of advice do you give these young ladies?
Two things primarily. If you want to change your image so you feel better, and then you create a sickness that was entirely avoidable,
Very important.
That compounds your self-esteem tremendously. There's an organization, I think it began in Chicago. It's called Flat and Fabulous. These are women who have undergone mastectomies and have chosen not to any reconstruction.
Wow.
Now, I'm not saying that as a male that I can comprehend what that is all about.
Right.
I certainly cannot. But I do know that if you have a problem with self-image and then you create your own illness on top of that, that's not going to bode well for your future psychotherapy. That's right. For sure.
Well, we've run out of time now, and I really want to thank Dr. Brawer. And I think this is probably one of the most interesting hours that we've had with regard to health frontiers, because this is really a frontier. Wouldn't you agree?
Absolutely.
I mean, it's an up-and-coming area. Like everything else, DNA analysis, epigenetics, as we become more and more aware scientifically of the things that can cause disease, we have to understand that there are things that one has to be careful of, and that one doesn't just get an implant placed in their body without careful forethought, informed consent, and expert involvement. And I think Dr. Brawer is the expert, and I am really grateful for your appearance on our show. And I think this is going to be a really hot topic among female organizations as well as male organizations, husbands, boyfriends. You ought to see this program and really give advice to your loved ones. And with that, I'm going to say it's been great having you, Arthur. Tell us where you are.
I'm 2 blocks from the ocean, waiting for the next winter storm so I can have beachfront property at 170 Morris Avenue in Long Branch.
In Long Branch, New Jersey. And Arthur has been around the country and probably around the world talking about these very topics. These are so insightful and so new and so different a way of looking at a disease, as well as what we do to our bodies to enhance, of all things, our beauty. And I want to thank you all for watching, and I thank Arthur for appearing.
Thanks for having me. It was a pleasure.
Thank you for joining us on Health Frontiers. I hope today's episode provided valuable insights into your well-being. Remember, this podcast is not a substitute for professional medical advice, but a source of knowledge and guidance. If you have any questions or topics you'd like us to cover, please reach out. Make sure to like, subscribe, and visit our website at www.healthfrontierspod.com. Join us next time as we continue our quest to uncover the latest in health and wellness. Stay healthy and empowered. Until next time, I'm Dr. Bob.